All right, if you're an athlete and you're having medial knee pain or patella pain, this video is for you. This is going to help open up those hips, decreasing the irritation on that medial knee. Let's get into it. All you're going to need is a band and some floor space. Let's test something. Let's test your internal and external rotation. Let's test that by doing a simple hip 90-90 degree test. What you want to do is sit on the ground, put your hip in hip flexion, and then your knee in about 90 degrees of flexion. Same thing with your back hip, 90 degrees here, 90 degrees here. What you want to do is try to push in, and then do you feel any pinching or tightness anywhere? And if you do, then I want you to try to rotate and then check the other side. If you feel any tightness or pinching anywhere, make note of that, because we're going to help improve this, which is going to help take pressure off that knee. First up is we're going to do a basic reset of the entire system. So I want you to lay down flat, and I want you to make sure your back's flat against the ground, and I want you to take some deep breaths. In and out. You want to do 3 of these. In and out. Make sure you're blowing up your belly. In and out. All right, once you get 3 of those, that helps reset the entire system. We're going to get into a little bit of a dynamic warm-up. We're going to go into the world's greatest stretch, which is where you're going to get into a lunge, and you're going to place your palm, your outside shoulder, palm on the floor, and you're going to take your inside hand and rotate up. You're going to get 3 of these. 1, 2, 3. And we're going to rotate. Same situation. 1, 2, 3. Again, this is just a warm-up. It's not a stretch. So you want to make sure that you're moving through this entire thing. Our next ones, we're going to do just some hip 90-90s. So we're going to do about 5 of these. So you're going to get a nice set. You can try to do it without your hands, but if you need a little bit of hand support, you can try that. And you're going to rotate through. Do 5 of these. 1, 2, 3, 4, 5. All right, so now the hip joint is nice and loosened up. You're probably still feeling some of that pinching, but now we're going to get into the actual mobility work that's going to help improve or decrease that pinching and also improve that mobility in the hip, taking that pressure off that knee. Let's get into it. So we're going to get into what we call a hip distraction. You're going to get you a band, and you're going to do this for both sides. It'll be about 45 seconds of work, okay? So you're going to put that band, step into it. You're going to get it on the front hip, in that front hip crease, and you're going to step out. You want a good amount of tension here. And you want to rock back and forth for about 45 seconds. You should feel that band pulling it outward. Nice. This is really working on an external rotation. Also working some ankle dorsiflexion. If you need something to hold on to, you can use a wall or anything like that. Should start to feel a little bit of a burn. Shouldn't be any pain. Then we'll get into the other side. Step into it. Same situation. Putting it in that crease of that hip. And rocking back and forth. 45 seconds of work here. If you need more tension, you can step further away. If you need less tension, you can step closer to the band. Again, should not be any pain. Should feel that femoral head being pulled out of the socket slightly. Stretch those ligaments. Open that hip up a little bit more. Got about 15 more seconds of Slight, gentle rocking back and forth. All right, great. So we got that done. So now we're going to go back into the hip 90-90, and we're going to do what's called active lift-offs. 3 different grades of this. You can either lean back, try to lift that ankle off. You see how that ankle pulls off? If you can do that, you can lean forward to make it a little bit harder. Try to lift that ankle off. It's a lot harder when you're leaning forward versus back. I'm going to lean back and let my ankle hold off, pushing that knee down. 1, 2, 3, relax. Push into it, 1, 2, 3, then relax. Push up, 1, 2, 3, then relax. And one more, 1, 2, 3, then relax. Good. We'll rotate it to the other side. Do the same thing. If you want to have a little more difficulty, lean forward. But if you need a little less difficulty, lean back. Pushing into it, 1, 2, 3. Woo. Push into it, 1, 2, 3. Pushing into it, 1, 2, 3. And one more. Pushing into it, 1, 2, 3. Great. All right. So we've opened up external rotation. Now we got to get into internal rotation. What you want to do now, take that same band, we pulled it sideways, laterally, away from the hip. Now we're going to pull it back posteriorly, okay? So we're going to put that, step into it with this right foot. We're going to get into a rocker. Put your toes together. The band is pulling your hip back. It's in that hip crease. Your shins are kind of angled out, knees are angled out. And what you do is just go forward and back. Just gentle rocking. We're going to do this for about 45 seconds here. On this side, I know you can't see it, but what this band is doing is pulling my hip backwards. As I come forward, I feel more tension. As I slowly control it back, I'm controlling that tension backwards. Feeling a nice, good stretch through this. Of course, if I wanted more tension, I could step further away from the band. If I needed less tension, I could go closer to where the band's anchored. So we got about 10 more seconds here. We're going to continue to do this. Open up that hip, especially the internal rotation to help that out. All right, so the last second, we're going to swap. Same situation here. Make sure it's in that hip crease, high as you can go. Toes together, chins angled out, and let's begin. Going up and back. 45 seconds of work here. This is a great mobility exercise. This is a great mobility follow along video if you're after a game or before a game, or you're before a workout or after a workout, just to help open things up, get things going, help decrease the risk of injury. If you're having any type of medial knee pain, anything like that, it really opens up his hips, takes that pressure off of that knee. All right, that's it for that one. So now we're going to go same into that 90-90 that we were in before, but now instead of the front leg, we're going to work on the back leg. We're working on internal rotation. So what I want you to do is I want you to push your knee in, lifting the ankle off, okay? You're going to hold it for 3 seconds. 1, 2, 3, slowly back down. Pick it up. 1, 2, 3, slowly back down. 2 more. 1, 2, 3, slowly back down. Staying nice and tall, make it a little bit harder. 1, 2, 3, slowly back down. 1, 2, 3, slowly back down. So rotate back through. You'll be able to see on this side really well what we're doing. We're pushing in. 2, 3, slowly lower back down. 1, 2, 3, slowly lower back down. Make it a little bit harder. Lean towards that leg. 1, 2, 3, slowly lower back down. 1, 2, 3, slowly lower back down. And one more. 1, 2, 3, slowly lower back down. All right, so we worked on internal rotation and external rotation. Now we want to add a little more functional strength, a little functional movement. What we're going to do is we're going to add what's called a Copenhagen plank, which is where you're going to get a bench or a chair. I have this step-up block, works the same. All you got to do is have something that you can put your leg on top of. Would help to have something you put your leg underneath. Also, just makes it a little bit easier. But I'm going to do this. You can do what's called short lever or long lever. Depends on how strong you are, your adductors are. But the short lever is you want to put your knee on whatever you're doing, and you want to lift up. As you lift up, you want to hold that position. Should feel right through this area here, a little bit on your plank here, holding that nice and strong. We're going to hold it for roughly about 20 seconds. Probably going to get a little trimmer here. It's because of the weakness in the adductor. So as you're holding, just breathe. Make sure you're doing nice, beautiful breaths. In and out. Really adding that mobility work. Now we're adding some strength on top of it. So we're going to slowly descend back down. We're going to go to the other side. We're at the same side here. Same situation. Going up. Making sure you're picking yourself up here. Holding it nice and straight. Filling it in those adductors. Holding it for about 20 seconds here. Not pushing off with that leg. I'm just having it here just for comfort. And then we'll slowly go back down. So that's one set there. You can do 2 to 3 sets of that if you want to. Adds more strength, add more time, add a little bit more challenge to you. So the next thing we're going to do is a single bridge hold. Same situation here. You're going to lay down flat. You're going to pick one leg up and then pick your butt up off the ground. And then you're going to hold it for 20 seconds. So we're really engaging those glutes and the hamstrings, making sure your pressure is on your heels the entire time, making sure you're isolating that one leg. You're not straining there. Once you get to 20 seconds, you can slowly lower back down and swap legs. Go up. And again, you're holding this for 20 seconds. This is really working on that posterior chain, something that a lot of athletes struggle with. That lead to muscle imbalances and problems later on in life. So once you get to that 20 seconds of that, you slowly lower back down. Of course, doing 2 to 3 sets of that, increasing the duration that you hold it, will make it a lot more challenging. The last thing we're going to do is going to do a split squat iso hold. So we're going to get into a nice split squat. We're going to hold this down again for about 20 seconds. Holding this right before that knee is touching. You should probably have a little bit of tremoring. It's okay. Again, we're going to hold this for about 20 seconds. Once we get to that 20-second mark, we can swap. This is super, super challenging. It's one of those things, adding in isometrics can really, really improve stability and make that mobility work that you just did, take it to the next level, allow you to hold on to the gains. So we get to the 20 seconds there. Again, you can add longer durations or more sets will just help increase that strength. So finally, we're going to retest that. We've done the mobility work, we've done the strength work. If you've done everything correctly, you should have more mobility. You should have less pinching and more mobility in your hips, in internal rotation and an external rotation. So even leaning over and coming back down. So I feel less tight. This is early morning routine, of course, right before a game or even after a game. Will help loosen you up, get you prepared, decrease the risk of injury. Also help with medial knee pain if you're having any of that. So this is Alex Panel. I'm with the Panel Performance Group. If you like this content, like it. And if you want to see more things like this, comment what you want to see. I'm here to serve, and hopefully this video helps you or helps somebody else. Thanks for watching.